Hi guys, welcome back to my channel. I am Nurse Babe Britt, and in today's video, I'm covering everything CRNA. So a CRNA is a certified registered nurse anesthetist. It is one of the top paying advanced practice specialties that nurses can matriculate into. It is known to be a very rigorous process and a challenging process, but very rewarding field and specialty to be a part of. A lot of you guys always have questions about CRNA, and so I went directly to the source and interviewed two of my friends that are currently in CRNA programs. I asked them a ton of questions about the program, things they did to get into the program, and what it's been like thus far. So if this is something that interests you, or if maybe you're trying to figure out which advanced practice pathway is best for you, this video is great for you. So please stay tuned and listen for more.
My name is Mario. I am a nurse anesthetist student at Emory University. I started off in the CVICU at Emory University Hospital, and this is my second semester, so we're getting into the weeds of things.
Yay, okay.
Hi, my name is Janae. I'm a first year SRNA. I also worked in the CVICU with Mario and Brittany at Emory University Hospital, and I'm just getting started as well.
Well, thank you guys for joining me. I'm just going to ask you guys a few questions that most people have when they're thinking about anesthesia school. So my first question is, what did you do to prepare for CRNA school? And anybody can go first.
Well, I mean, I guess it's kind of hard to prepare specifically for CRNA school, in my opinion. I think that there are things that you can do that may help you. So some of the things were, what unit you chose to work on. For example, me personally, I know that a lot of people say this about CVICU, that it's a great place to get your foundation for entering CRNA school, and that's because monitoring hemodynamics and titrating medications and things like that. Um, those will help you and help you understand like hemodynamics essentially. So I feel like that was good. Of course, not all CVICUs are the same. I really do feel like the one that me, Brittany, and Janae came from, like it was pretty good. We got a lot of hands-on experience. I mean, it was top notch. One of the best ones, and I don't regret working there at all. Was it hard? Yes. Was it stressful? Yes, but it definitely gave us a backbone to getting us where we need to get to. Now, aside from working on the unit, I really feel like, you know, even little things say, oh, you need to get your CCRN. That's just not something that they're just recommending. It really does help you dive deeper into some of the other material that you may not be familiar with in CVICU, and start critically thinking through things, test taking strategies, things like that. And me and Janae personally, we went ahead, instead of getting just our CCRN, we also got our CSC and CMC as well. And those helped also to prepare us for the rigor of CRNA school as well. So I just think it's a culmination of, everything that truly helped. Oh.
Perfect.
Yeah, just to kind of piggyback off of what Mario said, I definitely think your critical care experience is one thing you can do to prepare yourself. And I also agree, I don't think there's a really good way to prepare yourself for the education of nursing to school, because it's not like your baccalaureate program or whatever type of nursing program you went to before. It's totally different, new concepts, advanced level thinking. You're having to think now as a provider instead of someone who receives instruction. And instead of just anticipating orders, you are now responsible for anticipating changes, but also implementing those orders and monitoring for adverse reactions. I think the best thing that anyone can do for themselves prior to going to CRNA school is just become a good nurse. Become a good nurse, become, good at what you do fundamentally, because regardless of what ICU you came from, even if you came from the top CVICU in the country. Whenever you start school, everybody's starting at zero. There are going to be concepts that none of you all know. And, you're not a ICU nurse going into anesthesia school. Some of the concepts are the same, but your role is completely different. So just become good at what you do, become good at communicating with different personalities, because as you enter into even graduate school, the dynamics will change. You're going to come in contact with people who, like, your personalities may not click, and it's very good for you to have that personal development of how to properly communicate. Definitely work on your own emotional intelligence, knowing, hey, am I taking this personal, or did this person actually give me constructive feedback? So just, all those things. And I think I can speak for all three of us. We learned a lot working in our unit. So I would say that. I would also say, make sure you understand why you want to become a nurse anesthetist, and make sure you understand what a nurse anesthetist does. Because so often we hear people say, well, I want to become a nurse anesthetist. Well, why do you want to become a nurse anesthetist? Well, because I want to be more autonomous. Well, you can have other jobs in the medical field and nursing to be autonomous. So why do you want to specifically go into nurse anesthesia? So know that. I also agree with Mario about getting your certifications, because again, a baccalaureate degree kind of gives you a general overview of nursing. Like, you are prepared to be a generalist nurse. And as you move up in education, you start to like master. So you master nursing. But if you have not shown you have mastered the specialty in which you're working in, I think you kind of have to question, okay, well, why are you trying to advance if you haven't mastered what you're currently working in now? And a way to show that you have mastered that specialty is by getting those advanced certifications. So that's what I would say.
Great.
I'm about to say that is very hard to follow. I guess that kind of goes into one of the questions I was going to ask is, do you guys feel like working in the CV compared to other ICUs like trauma, surgical, medical, neuro, how do you feel CVICU stands out? Because often you hear people say, okay, I need to get in CVICU before I start applying for anesthesia school. But I'm sure both of you guys have classmates that probably didn't have CV experience and they were still able to get into anesthesia school. So do you feel like there's more of a benefit being in a CVICU before applying, or do you think just any critical care?
You want to go first this time, or do you want me to go?
I can go. I think that any critical care area offers a unique perspective. So, for example, things that we may not be concerned about in CV, a neuro ICU may very well be concerned about it. So it's just a different level of perspective that you bring. I really, of course, I'm a CV nurse, so I'm gonna say CV nurses are the best. But I don't want to say that other ICUs do not give you good experience for CRNA school. I definitely think CVICU gives you good experience because, unless you work like in a coronary care unit, you're not gonna work with a swan, you're not gonna deal with some of the drips we deal with. However, we don't manage EVDs, a lot of other things, a lot of other units deal with. So I would say CVICU is good, but that's not the only critical care experience that will benefit you transitioning into CRNA school.
I would have to agree. Honestly, there are, besides me and Ashley Ann, there is probably one other person with a significant amount of CVICU experience in my cohort. Everybody else seems to be more of either like neuro, MICU. Um, they've done some other a hodgepodge of maybe a little bit of CV here during travel assignments, but nothing like that bread and butter. And I mean, that speaks to something, honestly. I think that honestly, going back to the last question that we had, actually, you know, whatever you put into your ICU experience is what you're going to get out of it. Okay. So being a good nurse, not just looking at the tasks that you've been assigned, but things that I learned even as an ECMO specialist, like I can't just be concerned with the things that I'm doing to the patient. I have to be concerned about what respiratory is doing to the patient, what these consulting physicians are doing to the patient, what PT, OT, what they're doing with the patient, and how that affects the overall outcome of the patient. So, just an example of that is most ICU nurses, honestly, most of them, I will say they'll look over at respiratory, they're doing their thing on the vent, and you're just like, I don't really know what's going on over there. I'm not going to pay attention. That's respiratory. You can't think like that anymore. If you want to be a good nurse, you have to understand even the basics. You don't have to understand all the different mechanics of the vent, the different vent modes. Nobody's asking you to put in a vent mode, but you do need to understand how certain settings on the vent affect your patient and how it affects their outcomes and what you're doing and what they're doing, how it relates back to the patient. You need to know that. And you can get that. Every ICU has vents. Every ICU has vents. They're not expecting you to be a cardiac nurse, expert at cardiac, neuro, and NICU and all that stuff together. No, they want to know, do you understand your niche in your ICU? And then did you take it a step further and try to learn some neuro, try to understand some cardiac stuff if you're a MICU nurse? Like, did you go the extra mile? Because CCRN talks about all that. CCRN has cardio stuff in it. It has respiratory stuff. It has those components, but you get so focused on, oh, well, I know my stuff, but you don't really look at everything else. I'll give you another example. In CVICU, we don't really think about it. And you'll always hear every CVICU nurse, we hate neuro.
Mm-hmm.
Raise your hand as a CVICU nurse if you actually like neuro. You ain't gonna find it, okay? With CV comes neuro, okay? One of the biggest complications in cardiac surgery is stroke, whether it's hemorrhagic or ischemic. So it's not that you can't avoid it. You have to be well versed. And that is the biggest advice that I can give people. Be well versed. If you work in a MICU, fine. Know your stuff, but then try to learn some cardiac stuff. Do some extra reading. Go to your PAs, your MPs, your experienced ones, your MDs, and ask them questions. And if they're willing, ask them and get that information. That's how I learned. Aaron was my best friend.
Yes, love
Shout out
Aaron.
to Aaron.
Right. So you mentioned being an ECMO specialist. That goes into one of my questions. How do you feel like being an ECMO specialist helped you with anesthesia school? Or do you feel like it helped you in any way? Or is that something just
I do. I honestly do. Being an ECMO specialist, and for those that don't know what that is, it's not a perfusionist. Please do not get that confused because a lot of people aren't you the perfusion? I am not a perfusionist. Okay. I'm an ECMO specialist. I help manage the ECLS circuit or ECMO circuit. Can perfusionists do the same thing? Absolutely. They're probably more proficient, but you know, that's the skill set that I've learned. But either way, I think that becoming an ECMO specialist, it opened my mind. It broadened my understanding that, hey, you're no longer just looking at, again, what the nurse is doing. As an ECMO specialist, I had to know what changes the respiratory was doing, what the docs were planning on doing, how that was going to affect my circuit, if I was going to have to give more volume, go down, up on flows, adjust my sweep. All of that matters. And so I had to take the entire room into consideration. And that was one thing that becoming an ECMO specialist helped me to understand, like, hey, you just can't be focused on what the nurse is doing. I'm a nurse. Of course, I understand everything the nurse is doing. I'm talking to them, but I then had to branch out and be like, hey, respiratory, hey, can we change the vent settings a little bit? Like, can you make it like this? And I'm not an expert by any means on the vent. However, understanding that, hey, this is going to impact my patient care outcomes, I need to be at least have some understanding of what's going on. And again, a lot of nurses, one of the questions I got during school was like, you know, what's minute ventilation? And what does adjusting my PEEP do? What does adjusting my what you're figuring all these questions. You got to know this stuff. And it's not going to be a situation where you're just like, oh, I don't know, respiratory does it. Respiratory usually handles that. No, you are respiratory. How are you going to be in the patient's room? You're a critical care nurse and you don't know what this man is doing over here. Any ICU nurse that's going to let somebody walk into their patient's room and they don't know who they are and they're not going to question them has a problem.
Yep,
That's what I mean.
hey, who are you again?
I'm sorry, who are you? I don't care if you're the CEO of the hospital. I'm sorry, who are you?
Right.
Help you?
That is very true. So thank you for offering that insight because I think a lot of people don't realize, I guess it depends on where you work. Being an ECMO specialist isn't an option for everybody,
No,
even if they have CVICU experience. So it's interesting to hear how you feel like it plays a role in anesthesia and helped you where you're at on your journey.
for sure.
So,
And if you plan on doing cardiac anesthesia, you're going to have patients on bypass. You got to understand when the patient goes on bypass, I need to start making adjustments on my vent, when the perfusionist takes over. So it kind of helps me understand, like, I know the lingo that they're talking about. I can, come in and help crash a patient onto an ECMO circuit as a CRNA and not be blindsided and be like, what's going on? Like, I've never seen ECMO before. Like, no, I'll be there already. So I do appreciate that.
mhm. Okay, so my next question is, and I already know, well, Mario, did you take the GRE?
I did not. Emory did not. I took the GRE actually from my master's in nursing, but that was like years ago. But I did not have to retake it for Emory. They did not require it.
Okay. Well, it's good that I mean, you still took it. So what would you guys say, as far as, do you think, well, I guess you applied for a program that didn't require it. Janae's program did require it. So do you feel like people that's interested in anesthesia, do you think that's a good step to take, or does it just depend on what schools they want to apply to? What is your take on that?
This is my personal opinion, and all it is an opinion. If you look at the big picture of you going to anesthesia school, and most people, at least that I have talked to personally, they have a list of, I don't know, maybe five to 10 schools, I just say on average. Okay. So on that list of schools, so one of those schools is going to have the GRE as a requirement. Okay. And just think about it statistically, it's a test and it costs money. Neither one of those are in our favor. So, no one wants to take it. I don't think anybody wakes up and says, oh, I want to take the GRE today and, get a, I don't know, 375 or whatnot. Because the GRE was really made for PhD students. It wasn't made for anesthesia students. But if you think about it, the percentage of applicants who want to take it versus who don't want to take it and who will not actually take it is a lot lower. So if you want to if you want to be competitive and you want to be able to apply to more schools, statistically it makes sense to at least take the GRE because see now you meet qualifications to apply to more schools than just the ones who don't require it. Also, another thing to think about when there are more people who are probably not going to take the GRE. So the schools that don't require it are probably going to have more applicants. And just statistically, you have a higher number of people applying, the lower your chances of getting in. So, to me, it's just one of those things where do you want to not take it to save yourself a little bit of anxiety, which when you start school, the anxiety you have is not going to compare to the anxiety of you not want to take the GRE, or you just bite the bullet and say, hey, you know what? I'm going to just take it, see what I get, and, have it in my back pocket. Another thing to consider is some schools have different requirements for the GRE. Some programs don't necessarily require a score. They just require that you take it. Or they may have an average score. So that means that, some students may have made above 150 on the verbal. Some students may have made below a 150 on the quantitative, So I think just having it in your back pocket definitely statistically puts you at a greater advantage to be accepted into a program. But that's just my opinion.
Okay. And just for the record, how many years of experience did both of you guys have before applying for school? Because I think the minimum is 1 year ICU experience, but how many years did y'all have?
So it depends on what school you go to, because many may have 1 year, but some require 2 years. But to be frank, the average amount of experience that people typically come in with is like 4 to 5, honestly. Me personally, I started with Brittany at the height of the pandemic, right when it started in March of 2020. And I applied, what, 2022? Yep, in 2022. So I had, you know, 2 years when I applied, but 3 years by the time I matriculated into the program. So 2 to 3 years.
Mhm. I was a nurse in the pulmonary step down for about a year and a half. And then, let's see, I had about 3.5 years ICU experience before I matriculated. So, well, no, before I started the program. So I had about 4 years experience total as a nurse before I actually applied. So, and then too, I would definitely check your program. And that's the word of advice I'm gonna give. I always reach out to the program directly and see what their requirements are, because some programs may say, hey, we require 1 year of experience, but they may not count the first 6 months because some hospitals may have a residency program that's 6 months and you were not actually working as a nurse independently, so they may not count that as experience. Some hospitals may. So I mean, some programs may. So, definitely reach out to the program and get specific clarification on what they consider as experience.
Right. I'd agree on that. And just to piggyback off of that, honestly, I feel like people should be wary. Just because you have 2 years of experience doesn't necessarily mean that you've gotten what you needed to get out of that before you apply. You'd be surprised. Again, not all ICUs or people, I'll say sometimes it's not even the ICU's part. Going to back what Janae said, if you're not putting in the work and you're not actively trying to like learn everything and really have an understanding and refine your understanding of everything, then those 2 years are gonna they're not going to do you much good. You really need to like hit the ball rolling, okay? Be a good nurse first and foremost, but then after that, like really delve into the why. If you don't understand why you're doing certain interventions, then you probably shouldn't be doing them in the first place. Um, and you just have to know everything that you do, every little thing, every shift, patient positioning, all of that means something. Why did you do this? Why didn't you do this instead? What made you choose this medication? Why not this medication? And again, like Shanae said, you're going to be the one who is putting in the order and who's doing the intervention. So you are the nurse and the doctor at the same time. That's you. Nobody's going to be telling you what to do. Everybody's going to be looking at you like, so
Hmm.
what's going on? How much of this to give? You can't be sitting there like, I don't know how much, what the order say. You are the order. You are the order. So it's just kind of like, be wary of that. And again, jumping back to the GRE thing, just to piggyback off of that, I would say that one, I just tell people I took the GRE one time. I just happened to pass it as high as I need to pass it for my other program. But it is not an indicator, and many schools are hopefully phasing it out. It's not an indicator of how well you will do. So please don't be discouraged if you don't do well the first time. Again, the test is not for really made for us. It's not focused for us. It's a bunch of high school math and stuff you learned way back when that I still don't know. But don't be discouraged at the end of the day. Yes, like Janae said, the statistically, it'll behoove you probably to go ahead and take it. But if you don't do well, don't let that discourage you, because quite honestly, like you can still be a great CRNA.
Mhm. So quick question. You guys both went and got your CCRN, CSC, and CMC and all those things. Is there
Alphabet.
anyone in your program that doesn't have a CCRN, at least?
Yeah, I
Doesn't.
actually have one.
Okay, so would you say that's actually not a requirement, or is that something like what would you say on that?
I will say that it is strongly recommended for the reasons that I had said previously, that you really delve into understanding certain topics and being a well-versed nurse. However, there are just some individuals who are just they just got it like that, you know? They just got it like that. And obviously when she had her interview, she went in there and she killed it. Now, some places will say CCRN preferred, and then some will say required. And so apparently Emory is one of those, it says prefer, strongly recommended. That does not mean that you won't get an interview. It just means like, hey, when you come into, if you're selected for this interview, you better be ready because they're coming with it. Because I'm here to tell you, Emory's interview was no joke. Okay. I was sweating bullets in there. Um, so I would just say it's more so to prepare you. And they also want to know, this was one of the questions I got. She said, did you pass your NCLEX? And I was trying to figure out like, well, obviously I passed it, like I'm here. I was confused about this. She was like, no, how many times did you take it? And they ask that question because they want to see how you perform on standardized tests. They don't want you to get to the end of school and not be able to pass your boards, basically to practice. So doing the CCRN, how well you did in your NCLEX, things like that, those are like kind of indicators to them, like how does he handle standardized testing? And the fact that I had three other standardized tests after that, it showed that I can sit down for a test and I can pass. I
Mm-hmm.
can make this happen. So those are my 2 cents.
Okay. Janae, is there anybody in your program that you know of that doesn't have it?
I'm not sure because I'm still in my first semester, so I'm still getting to know some of my classmates, so I'm not sure. However, I would challenge anyone who doesn't have it, who doesn't want to take it as to, well, why don't you? This is, you want to further your education, you want to specialize in this critical care area. Why don't you have your critical care certification? I think actually me and Mario was kind of like steps, like he got when he took one test, I took it after him, and we kind of like had that, I wouldn't say competition, but we kind of motivated each other, like, hey, why you don't have your test? Why haven't you took your exam? And I know we had like a board, I think, with our names on it. And I was like, I want my name up there. Like, I'm not going to keep walking past here and my name is not up there. So I definitely would challenge someone to think, well, if you want to set yourself apart, if you want to be distinguished, if you want to show, hey, I am dedicated to critical care, then why not take the certification that will display that? Because, your references, it's one thing if somebody can say, hey, this is a good ICU nurse, you get what I'm saying? But you can't argue with that certification because now you have a measure saying, hey, this nurse is proficient um per AACN standards or guidelines to be a critical care nurse. So that's what I would say.
Okay. So my next question is, what has your experience? So you're in semester 1, Mario's in semester 2. What has your experience been so far with the workload in the semesters that you're in?
Babe, semester one was a cakewalk compared to now. Now I feel like every day I'm fighting for my life. I feel like R. Kelly right now. I'm like every day I'm fighting for my life. These, I don't know how it is with other places. It may differ, but I'm here to tell you, Kelly Wilkes Nicely and Dr. Erica Moore,
Mhm.
Dr. Kelly Wilkes Nicely, I'm sorry. They don't play. They do not play. You got to be on your stuff. We hit the ground running from the beginning of the semester. It is just like go. It's like there's how Dr. one of my other professors said they're swelling your brains as much as possible until it's about to burst. And then they kind of let you come back and then they swell it again and just exercising. And I've never put so much information in my head in such a short period of time. It is grueling. I will say it is not for the faint of heart. This better be something you want to do. It better be something you want to do and you're passionate about. Because if it's not, you're not going to make it.
Mhm.
Janae?
It's probably hard.
Well, well, my first semester is online, so it definitely was a adjustment for me because it's been a few years since I've actually been in school and been responsible for studying for a test and deadlines and showing up for an online class. But as of right now, for me, it is manageable. Now, in about 3 months, I don't think I'll be singing that same tune. But as of right now, it has been manageable. But I have had to, get back in the swing of learning, what test strategies work best for me, remembering what type of learner I am, and make sure I utilize my resources that are offered from my program.
Agreed.
So that sounds very, to some people, it might sound kind of daunting. So what do you do to balance? Because obviously, this is something you guys both want to do. What do you do to balance to make sure that you're ahead in your classes? Do you have time to still have a personal life, to have some type of breakaway to clear your head? Like, what do you do to stay afloat so that you're not like in this constant stress mode? Or, I mean, maybe you're not able to do that. What are your thoughts?
I mean, I'm all for, a little bit of some alcohol or something just to get through some time after a hard week or whatever. But I mean, to be honest, like the ugly, the big thing in the room basically is you're going to have to sacrifice. And I'm not saying that you won't have. I can say that first semester I had a lot more time on my hands that I could like, get stuff done and still have a little bit of a social life. And now I'm starting to see my social life kind of like, slide out the door a little bit. I'm starting to neglect people a little bit more and I'm feeling more anxious and more pressure. And quite honestly, I mean, I've felt that way before, especially going back to school, in grad school. And honestly, my classmates become my sounding board. It's really hard to get through this program alone. I would not recommend that to anybody. At least try to find one other person that you can like, talk to or get with and just because they're the only ones that are going to understand what you're going through. Nobody else is, the other people, they don't even know what nurse anesthesia is. They all think they were anesthesiologists and that's what it is, but they don't understand like what it takes and what we're going through. So I just feel as though like lean on your classmates, lean on that other person if you can. And like even tonight we're going to our real tacos and we're having margaritas after I get done studying here. Like that's, you just got to make it work, do what you got to do, and then take a break, cry a little bit if you need to, and then get right back to it. Put on your big boy pants and let's go. So
Mm-hmm.
For me, I definitely have had to find ways to de-stress so I don't end up in shambles. Um, so I definitely, my faith is really big for me. So I just make sure I start my day with like some type of Bible verse or motivational message on YouTube or something. I try to start my day that way. And I make sure I take breaks. So if I feel myself getting anxious or if I have to keep pulling myself back into focus, it's time to take a break because your brain is not absorbing what you're looking in front of. So definitely utilize breaks. I definitely make sure I talk to my family. That helps keep me grounded a lot. And like Mario said, definitely have a support system that can hold you accountable for your schoolwork and for break time. I'm blessed that I have a really good study group, and sometimes like we'll study, and when somebody say, "Well, hey, I'm sleepy," then we cut it off at that point. Even if I'm not sleepy, we cut it off. So I think that's good, and definitely exercise. I try my best to make sure I exercise at least 4 to 5 times a week because that releases endorphins. Another thing is making sure if you can, you get enough sleep. Because when you don't, we all know certain healing processes don't happen inside your body, and then you're playing catch up the next day you wake up. So definitely, I would say getting sleep and also utilize your professors and the resources that your program offers because you are paying tuition. So you are paying for all the resources and your professors are there to help you. And they're there to help you succeed because when you don't succeed and they don't succeed, and that's not the goal for anyone. So I would definitely say utilize your professors, utilize any resources your school offers, and remember that you are in nurse anesthesia school, but that is not the only part of you. You have to feed the other parts of you. You cannot allow yourself to be um solely
wallowed up.
Yeah, you can't, that you are a nurse anesthesia student, but you're also a son. If you have kids, you're also a mother, you're also a wife. So just not forgetting those parts of you and watering those as well, because that'll help keep you grounded when you may have a bad day in school, but you may come home and be an awesome mom or, be an awesome daughter. So I would definitely say that.
Okay. So quick question. I know your first semester is online. Mario, was your first semester online or was everything in person?
It was hybrid, so it was some online, some half online, half in person, basically. And now, as I'm moving through, it's becoming we have one online class this semester, and the other three technically are in person. So I think it starts with online, and then it slowly shifts to more in person plus or minus like one or two classes. I'm not really sure how that works, but it's hybrid. But your anesthesia courses, they're going to be in person always. The
Mhm.
other nurse practitioner, evidence-based practice, whatever other things, those are probably going to be online with whatever. But your anesthesia courses, you will be in person for those.
So were either of you able to work during the first semester at all?
I didn't even try it. I mean, in between breaks, I would do like medley or something like that. I, got in with that, but I have some classmates that are still working. They're not working in the ICU per se, but it definitely does not lend them as much time to study or to rest. And they can do it. Kudos to them. My body's not built like that. I too much stress, and it's like, no, I just want to no excuses for why I can't be successful. I don't want any excuses for that. And I don't like riding the line basically on passing because unfortunately you fail one class during this and that's it. There's this is a one and done thing. There's no coming back from it. And if you got kicked out of one nurse anesthesia school, you're probably not going to get into another one because they communicate with each other. So
I was able to work for a short period of time, but it was at a like rehab nursing home, so I didn't have to think that much. And I worked like 1 8-hour shift a week, and most of the time it was an 11 to 7. So, but even still, that took time out of me because I transitioned home with my family, so that was a transition. And I had to move for school. So I worked a little bit just to keep some gas money and grocery money and, not eat up all my parents' food. But yeah, I definitely, if you cannot work, I would definitely recommend that over working. Now, sometimes, you have to do what you have to do. But for me, after like the first couple of weeks, and I felt like, what I'm getting paid is really a drop in the bucket to the end goal, I just decided to stop.
Hmm. Okay. So with all of that being said, what advice would you give viewers that are watching this video as far as anything anesthesia, or even nursing, anyone who's interested in CRNA? What advice would you give?
I think that the biggest advice I would try to give, is having some pride about being a nurse in general. Um, and just the profession. You're coming into this profession. There's a lot of political stuff that we're starting to get into now with everything. And I just feel like, if anything, we need more decent people inside of medicine in general, in all realms. So, um, I know everybody likes to think of themselves maybe as being like, oh, I'm an angel, I'm perfect. But to be honest, like again, you're gonna have to be dealing with different types of people. Some people are not gonna like you. The surgeons are mean, or you know, build a thick skin, but don't let that turn you into a mean or bad person. Like come in and be willing to help each other. Don't come into these programs and thinking, "Oh, I'm just here for myself. I'm just in it for myself." That's very selfish. You're gonna push a lot of people away. You got to come in, be able to interact with different people, be able to have conversations and to back down. Like everything doesn't need to be a battle. Okay, you don't need to rebuttal to everything somebody says. Like just come in with a positive attitude, be a positive person. If you are not a positive person, please stay out of the profession. I'm just going to say that. Stay out of the profession. You probably shouldn't even been a nurse. But, I'm going to keep it real. Y'all know
I
me.
mean, that's true though.
I'm gonna keep it real, and like, have some sympathy for not only patients, but your professors, your classmates. Like, work with each other towards one goal. Because at the end of the day, the competition has ended once you get your acceptance letter. There is no more competition. We are in this together, okay? I'm helping you just like you help me. I'm gonna drag you across that finish line. Okay. And I hope that you would do the same for me when I need it. Okay. Because we're all gonna come in with different experiences, different things. And there are some things that you're gonna understand, and there's some things that I'm not gonna understand that or vice versa, or whatever. So it's just kind of like help each other through that. My neuro nurse that we got in my program, brilliant, could walk me down an EVD and everything in the brain, all the centers or whatever like that. Clueless when it comes to a PA catheter, but that's okay. That's not her experience, because just like how I'm ignorant to, the MCA, ACA, PCA in the brain and all that stuff that's happening, she's got that down. And I can come in and help her with the PA stuff, and she can come and help me with the neuro stuff. Like, you guys got to help each other, because if you're trying to do this on your own, you don't need to be in the profession, because nobody does it alone. Even when we do matriculate into the profession, we're not going to be by ourselves. I mean, we're good. Don't get me wrong, but we're fallible.
Mhm.
We don't have four arms. We can't get everything. So understand that, So again, just stay out the profession if you got a nasty attitude.
I'm glad you said that, because it is very like it's a lot of teamwork involved, and I think people don't realize that. And it's like if you try to do everything by yourself, you're just gonna drown,
You're just gonna drown. This is a team sport.
right? And you're not helping yourself or your
Right.
patients.
Oh, I'm a CRNA. I can Okay, tone it down.
Right, exactly. Janae, what advice would you give someone?
Um, I would say, I'm gonna say what someone told me. If you're waiting for any part of this journey, and really anything in life, to be comfortable, it's not. So you might as well get that out your head. Your application process probably is not going to be comfortable. You waiting for interviews, it's not going to be comfortable. Your interview is not going to be comfortable. Get that out your head and allow yourself the space to grow. I know me personally, I when I transitioned from the step down to the ICU, it was a big shock for me because I was very proficient, where I was very well respected, with the physicians, surgeons, the advanced practice
Yeah.
providers, the patients. I was doing pretty good. But once I transitioned to the ICU, I had to learn how to allow myself to grow. And in that process of allowing yourself to grow, you have to allow yourself room to make mistakes, because you don't grow if there are not any mistakes, so you don't do the right thing. So I would just encourage anyone to realize this is a process that you have not went through before. And even if, like, me and Mario's process may not be your process, there will be similarities, but there would be big differences. So allow yourself that space. Also, don't negate the hard things. Don't not do something to prepare yourself for school just because you think it's going to be hard, or just because you think it's going to be stressful. And that's in life too. You can't skip the hard parts. You may work with someone who has been in your same unit for a year exactly. They may get into school on the first time. It may take you 2 or 3 times, but when you both graduate and you're in operating rooms next to each other, did it really matter? Absolutely not. So, just knowing this journey will be specific to you. Also, to piggyback off of what Mario said, you know, patient care is a team sport, regardless if you're physical therapy, occupational therapy, speech therapist, respiratory, nursing, the provider. We can't function independently of each other at all. We all need to come together for the betterment of our patient. And something we are learning in one of my DNP classes is interdisciplinary teamwork, right? So you need to work with different disciplines, and that same mentality transfers over into school. For example, you may have someone who's a great writer. Okay. You may not be a great writer. There's nothing wrong with them helping you versus I may be very strong in pathophysiology. There's nothing wrong with me sharing, tips or helping someone teach. So I definitely agree 100% with Mario. You have to learn how to take yourself out of it, take that ego down because we all have an ego, and realize, hey, the goal, there's a common goal. And to reach that goal, I may have to have help. And there's nothing wrong with that. And, I think at least for me, when I was researching CRNA school and just different processes, there was a lot of like self-pride. People will talk about, well, I did this and I did that, but people rarely talked about, having to step back and accept, hey, I'm in a new arena, I'm gonna need help, and let yourself feel that. I was working on an assignment and I, was asking for help from this person or that person. And I thought about it. I said, you know what? If I ask all these people for help, I'm not giving my professor a chance to help me. I'm not letting my professor tell me what she thinks I can improve on, and I'm kind of robbing her of that opportunity. So after I came to an agreement with that, it took a lot of pressure off of me because now I'm allowing myself to grow. So that would be the biggest thing I would say, aside from the certifications, aside from taking a GRE, just give yourself a chance to grow because you're going to grow a lot through those next 3 years. And if you don't practice that skill before you get into school, you're going to have a hard time once you get into school and you're faced with opposition and, there are going to be times where you need to grow. Um, yeah, that would be what I would say. And another thing I will say, do not listen to anybody who has not been where you are going. Don't do it.
Absolutely.
If they are not where you're going, it's really no point in you listening to them because you'll create a lot of anxiety
Mhm.
by creating a reality that's not even there. And that goes back to what I said before. If you have a question, reach out to the program director. Every school I applied to, I reached out to the program director or the program manager, and they answered my question directly. And most of the time, I had the wrong interpretation about a requirement. I almost talked myself out of applying to the school because I felt like I didn't meet the requirements, in which in actuality I did. So if you have a question, reach out directly to the source. Don't, take someone's word for it because 9 times out of 10, they heard it from somebody else, who heard it from somebody else, who heard it from somebody else, who great grandmama graduated from school in 1962. So, definitely go to the source if you have any questions about anything.
Well, thank you both for that. There was one question I did forget to ask, and y'all kind of answered it in some of the other questions, but why did you choose anesthesia over some of the other pathways you could have chosen to advance your career?
Mm.
Want me to go first again? Or you want to go?
I can go. I think for me, when I decided that I wanted, well, first off, I always knew before I got my undergraduate degree, I wanted to get some type of advanced degree. I just wanted to for myself. And after I started working in the step down, I really didn't know what I wanted to do because the good thing about our profession is there are so many ways you can advance your degree. But after transitioning to the ICU, I found that I really enjoyed intubations. Not necessarily the the act of it, but the fact that, okay, I see my patient is having an issue ventilating and oxygenating, so we can preemptively help them by putting a breathing tube in before they get to the point where they can't oxygenate or ventilate themselves. I really enjoy sedation. I actually had one of my first learning experiences in the ICU was with sedation, so I enjoyed that. And I wanted to provide care instead of managing care. I think there are some paths where you manage care through multiple patients and you can directly provide care. And I still wanted to retain that low ratio one-on-one care to my patient. And I think the biggest thing for me, I'm the eldest of three, and whatever career I picked, I wanted to make sure I could protect somebody because I always protected my siblings. Like anyone who knows me knows I care about my siblings. I will stand 10 toes down in front of anybody of my siblings. I always wanted to protect them. So one reason why I wanted to be a nurse was because I wanted to be an advocate. I wanted to protect somebody that couldn't protect themselves. And with anesthesia, we are willingly taking away all of your protective reflexes that you have, everything that your body has in place to tell me that something is wrong. I'm taking those away to get you through this surgery pain free. And I feel like there's no other there's not a higher level of advocacy, other than me taking away your consciousness. And now I'm the one that's advocating for you in this moment. So those are some reasons why I chose anesthesia.
Very well. Um, Me personally, I think it's fun. Um, I mean, it is what it is. Like, I think it's fun. It's enjoyable. My professor said it best herself. It's interesting that you are the person that's going to be manipulating people, essentially. You're manipulating their functions in their body. Um, I give this that does this, and then I give this that reverses this. And it's just like it's playing chemistry with people, basically, in a safe way. Point that
Mhm.
out. In a safe way. And I think it's amazing that we're able to, one, I do love the autonomy aspect, but you can be autonomous as a nurse practitioner too. I just think that, um, I love, like, going back what Janae said, not only just I like providing the patient care directly, but also I'm also managing the care as well. I am the whole thing, and I just think that that's wonderful. I love learning, education. Obviously, I wouldn't be here if I didn't. And I feel like everything that I can learn is just something that makes me a better clinician, that adds one more thing in my arsenal to where I can help somebody get through something. And the other thing is, whereas nurse practitioners, they typically specialize in a particular area, as a CRNA, I have to know how to take care of everybody from a neonate to when they're first born, all the way up until you're 150 years old, so you just get this broad range of understanding of everything. And you can't beat that. It doesn't matter if it's a child, my nephew, my little nephews, or my mom or my dad. Like, I will be well versed enough to be able to help them get through that, and of course my other patients that I'm not related to, that I don't know. And I just think that's a wonderful thing. It's a great feeling when I can help this patient if they had a traumatic accident, or if they're just here to get, a new heart, or get a bunion taken off or something, just to help them get through it. They're pain free. They're up talking to you, and just like, I'm happy that I could get you from this difficult point in your life or whatever, and make you feel better, and to relieve your anxiety. Because another thing that they talk about here, we talk about anesthesia with, medications, pain meds, but verbal anesthesia. We talk about that all the time in my class, and that's the act of just talking to your patient to reduce their anxiety levels.
Mhm.
Verbal anesthesia, helping them get through something. And I find that wonderful. That's again why I say that you have to have a decent personality before you come into this, because it's not just about, oh, I push a few meds here and I do this, and oh, my patient's not talking to me anymore. No, you're going to be communicating with your patients pre, post, and sometimes during an operation, depending on the operation that it is. You have to have some interpersonal skills. You have to. If you don't have that, then again, please go do something else.
Mhm. Janae, did you have anything to add?
No, I think I definitely agree with the interpersonal skills. I think, anybody can be taught a concept, and anybody can be taught how to do a skill, but you can't teach humanity. You can't teach, you know, like being empathetic. You can't teach that. So I definitely agree, and I'm glad he brought that point up. You have to care about people, because people can sense when you don't care about people. Even us as when we go to the doctor and we're patients, we can sense, hey, this person really doesn't maybe they don't care about me as much or whatever. So I haven't got, that far in my program yet, but I really am grateful he brought that up, because I think a lot of people forget that part of it. You are a nurse, anesthetist,
You were
first. You are a nurse, and all of those nursing theories, Gene Watson, caring and compassion, you don't get rid of those things just because you're getting an advanced degree. At the core, you still need to keep that. And to be honest, your personality and your character will get you a lot farther in life than any degree will.
agreed.
Mm-hmm.
All right, thank you guys so much for tuning in and watching this video. I know it was a ton of great information. If you have any questions whatsoever, then please feel free to place them in the comment box below. Again, I am Nurse Babe Britt. Don't forget to like and subscribe to my YouTube channel. Turn those notifications on so you can be the first to know when I post my